Greeting and a warm welcome to everyone joining us from the various corners of the digital realm. Today we are going to discuss about the topic health policy and advocacy, shaping policies for better public health outcomes. I am glad to introduce the speaker of the day, Mr. Elvin Mfuzi. Over to you.
Good afternoon to everyone, and you are welcome to today's webinar. And I would like to apologize for starting a bit late. We had an internet problem. However, that has been resolved. So in the last webinar that I presented, I looked at emergency preparedness with a focus on cholera. And today we'll look at shaping policies for better public health outcomes in Zambia. So we want to look at public health policies. But first, we'll have to understand what a public health policy is and give a few examples. Then we'll look at the policy focus area in Zambia. What are some of the issues, health issues that we are facing as a country? And what are some of the recommendations or suggestions that can help shape these policies for better public health outcomes? We've been faced with quite a number of diseases of late, especially communicable diseases like cholera in the previous season, and we saw the impacts of the disease on public health community. So we want to look at what are some of the areas that we can focus on in terms of policies so that we can better be prepared for certain health problems and be able to handle them better. So we'll also look at other countries. What have they done about what some of the public health policies that they've come up with in order to, increase healthcare coverage for their citizens. So to start with, I'll define what public health policy is. So public health policy refers to the decisions, plans, and actions undertaken by the government or an organization or communities in order to achieve specific healthcare goals and improve the overall health of a population. So the ultimate goal of a public health policy is to improve the health of the population. We know the importance of this. When we have a healthy nation, it means that the country will be productive and the economy will do well, will thrive in all areas. So public health is really important. And as Texila American University, will continue talking about, public health issues that really affect the nation or affect us in the communities we live in. So what is the importance of public health policies? So public health policies are essential for improving health outcomes of the citizen, also reducing disease burden in the country, and also ensuring equitable access to healthcare services, right? We want people to have access to healthcare services regardless where they come from, regardless of their social, economic status. It is actually a right for everyone to access quality healthcare services. So this presentation explores Zambia's public health policy landscape and we look at lessons from other countries, like I said earlier. So if I may give just an example of a public health policy that was passed in Zambia in 2008, the tobacco-free zone or smoking-free zone, right? So this has been implemented actually in quite a number of countries. So many countries have implemented the policies to reduce tobacco use, okay, such as banning smoking in public, like what was introduced in 2008 in Zambia, right? And also imposing high taxes on tobacco products, and also running public education campaigns about the health risks of tobacco. Actually, I was watching on BBC the other time. In the other countries, Australia, where they put the packaging of tobacco, put discouraging images of the effects of tobacco on the packaging of cigarettes. So the whole idea is to discourage people from, smoking or using this tobacco because of its harmful nature to human health. So quite a number of countries have adopted this framework convention on tobacco control, okay, by the WHO. Over 180 countries, including Zambia itself. But if you look at what has been happening, is this a tobacco policy effective? So something that was done to check common public places was found that 55% of people are still smoking in public, right? So there are a lot of issues to be done when we talk about public health policies in terms of from implementation to ensure that the policy is working, right? We need to monitor and evaluate to ensure that the policy is actually working, right? So let's look at some of the current public health challenges that we are facing in Zambia. So number one, there's been a high prevalence of communicable diseases. We talk of HIV and AIDS, talk of malaria, we talk of TB. These are diseases that have been on the rise. So according to the Zambia Statistics Agency of 2024, this year actually, HIV prevalence rate in Zambia is approximately 11.1% among adults aged between 15 and 49. And of the total population of people living with HIV, it has been estimated to be 1.4 million people living with HIV in Zambia. And of the 1.4 million people living with HIV in Zambia, only about 1.1 million are on antiretroviral therapy. So look at the remaining number. These are the people that might know their HIV status and they're not on medication. Some don't know their HIV status and they're not on medication. So we still have a huge role to play when it comes to combating HIV and AIDS. We talk of malaria, right? It was in 2021, sorry, it was recorded, the country recorded 3.7 million malaria cases and 8,806 deaths from malaria. So this is quite a huge number, and we shouldn't be, losing lives from diseases that are preventable. Then also we look at TB itself. Zambia reported an estimated 59,000 TB cases in 2020, with an incidence rate of 307 cases per 1,000 people in 2001. This is according to the WHO. Also, the rising non-communicable diseases such as diabetes, hypertension, and also cardiovascular diseases, CVDs, high blood pressure is prevalent with an estimated 40% share of non-communicable diseases cases as added records are shown. Then also diabetes, the prevalence of diabetes among adults aged between 20 to 79 is approximately 4.5%. And many cases remain undiagnosed due to limited awareness and diagnostic infrastructure. So we are just looking at the burden of disease that we are facing as a country currently. Then also limited access to healthcare in rural areas. I'm glad to say that we've made quite tremendous progress when it comes to access to healthcare. But there's a lot to be done in order to ensure that even people who are living out there in rural places, they are able to access health services. That way will reduce the number of people dying from especially preventable diseases. Then also shortages of healthcare personnel and resources. This again, there's quite a huge progress that has been made when it comes to employing the workforce, the health workforce, and yeah, we're looking forward to situations where we have enough workforce to assist in the treatment and handling also of health problems in health facilities. Then also a weak health information system for decision making. We need to build reliable health information systems which will assist in decision making, right? Um, in other places, we're still using paper-based way of recording health problems or complications or important data to do with HIV, maybe testing or something. But if we invest in a health information system, it will assist in decision making so that we make informed decision based on the real problems, actual problems that have been reported from these different health facilities in the country. So what are the policy focus areas that we need to focus on? So number one, we need to look at strengthening our primary health care systems, right? These are the first contact or point of healthcare. So if we strengthen primary healthcare systems, then we'll prevent more diseases and prevent more people from, dying. Then also expanding universal health coverage. It's a right of every citizen to access quality healthcare services, regardless of where they are, regardless of their social economic status. Then also promoting health education and preventive care, right? Health promotion. We need to invest more in health promotion so that we avoid more people getting sick, right? That way, the country also will reduce expenditure on the curative aspect of the medicine. Okay, so if we invest in public awareness, public education, in order to prevent diseases, we'll have fewer people going to health facilities for treatment or getting sick. So that way we'll save the limited resources for other developmental issues. Then also you need to leverage on technology for health service delivery, right? So there's a lot of technologies that has come now with these advancements, IT, AI, use of AI in order to treat certain health problems and also to solve, issues that relate to the well-being of people. Then also enhancing public private partnership, right? Collaborating with other stakeholders that are interested in maintaining and restoring health of the people. It's very important. So we look at lessons that we can learn from other countries like Rwanda, for example. So in Rwanda, there's a community-based initiative called Rwanda's Mutuelles de Santes that has achieved nearly universal health coverage. So this method or system of ensuring that health services are actually at the doorstep of the citizen has proved to be effective in countries like Rwanda, right? It has enabled people, the citizens of Rwanda, to access health services right at their doorstep, and also, introducing affordable premiums. And also, it is a community-owned program, so the community feels part of the program and they take responsibility. And what has been the significant outcome from this kind of community-based healthcare insurance, there's been a significant reduction in maternal and child mortality rates in that country. So these are learning points. There's nothing wrong in emulating what other countries are doing. If it is working well and good, we can also adopt such kind of, health policies. Then we also look at India, or rather, let me just ponder more on the outcomes and impact. So there's been an increased enrollment from the time that this scheme was introduced in Rwanda. In 2020, over 85% of Rwanda's population was enrolled in the scheme. So 85% is good progress, it's a good number, right? And also it has led to improved health indicators. There has been a significant reduction in maternal and child mortality rates and increased utilization of healthcare services. And that's what we want, okay? Then also it has bridged the gap, okay? Equity and access, rather in health access. So the program has narrowed the disparities in healthcare access, especially for the marginalized populations in rural areas, right? So these are schemes that are effective, and they've proved to be effective in other countries. And I'm very positive that they can also, such kind of policies can work also in Zambia, right? So we look at it also, we can learn from India. India also's national health mission. The national health mission focuses on accessible, affordable, and quality healthcare. So what has been the key initiative? Accredited social health activists for community outreach, right? So the JSY also is an initiative to promote institutional deliveries, right? And the outcomes also, they've been are very good and positive. It has led to the reduction in infant and maternal mortality rates in that country, right? This is also a learning point. You can learn from countries like India as well. So what are some of the recommendations that we can make for the country? Again, these recommendations, this is a webinar presentation. This is an opinion of me, the presenter. So some of the recommendations that the country can adopt is a community-based health financing model, like the one that we have seen in being implemented and working very well in Rwanda, right? Then also strengthen health worker training and retention programs, right? We need more experienced health workers to remain in the country, right? Not a situation where they're leaving for greener pastures outside the country, going to other countries. So there must be some kind of mechanism to retain these health workers and also train them, to equip them with new knowledge and methods of new methods of disease treatment. The number 4 also enhance intersectorial collaboration for health, right? Engage other stakeholders that are interested in ensuring that the general population is healthy and, in fighting certain health diseases in the country. Then also we need to ensure continuous monitoring and evaluation of policies, like the free smoking zone or policy in Zambia. Has there been monitoring and evaluation to ensure that the policy is working, right? So policies, we've looked at those focus areas, those policies can be formulated, but ensuring that the policy is working effectively to achieve its intended purpose is another thing. So continuous monitoring and evaluation is an ongoing thing that should be implemented to ensure that the policy that is meant to solve a particular health problem in the country is effectively working well. If it is not working, we go back to on the drawing board and look at what are some of the things that we haven't done, what has gone wrong, why is this not working, right? And also learn from other countries, like those two other countries, just to mention a few that I've looked at. So in conclusion, we can say shaping effective public health policies require collaboration. It requires innovation and also adaptation of proven strategies from other contexts, right? So Zambia can achieve better health outcomes by prioritizing equity, efficiency, and sustainability in policy design and implementation. So this is the conclusion of our lesson today. And I'd like to hear if there are any contributions. And yeah, let's learn from one another. I'm not an expert when it comes to public health policy, but we can educate one another in this field and ensure that we have a healthy nation and formulate policies that work effectively in order to um, solve the high burden of disease that we have in the country, those diseases that I've mentioned, the communicable diseases, non-communicable diseases, and so on. So I'd like to call upon the audience if at all there are any contributions or questions.
So, is there any other questions from the attendees end?
I'd like to thank you so much for attending this afternoon's webinar. Thank you so much, Mr. Is it Robert or Robson? Yeah, thank you for listening, and hope to join you next time to have the next presentation. Yeah, I call it a good afternoon.
Okay, thank you. Thank you so much for joining us. A big virtual thank you for each and everyone making our webinar a success. Thank you. Thank you, Mr. Elvin. Thank you so much for the wonderful presentation.
Okay, thank you. Welcome.